Hi everyone, continuing with the submandibular triangle, also known as the digastric triangle. It is right here, you can see, right? Now we're done with its boundaries, roof, floor. Now let's talk about the content. When you talk about the content, so there'll be two portions. One is anterior and one would be the posterior. So anterior is the one right in front. So mylohyoid is the floor, right? So we're going to take mylohyoid as the base or the floor. Now anterior to this will be the interior part, posterior to mylohyoid will be the posterior part. So when you talk about the structures that are lying superficial to mylohyoid, what can you see? What do you think? So we have the superficial part of the very important gland called submandibular gland, right? You also have some lymph vessels, you have lymph nodes, you have facial artery and facial vein. So right here in this diagram, you can see we have a facial artery and this is the facial artery, and we also have a facial vein, right? Let me show you. There's another diagram. Let me work out where that is. Yes, right here. So facial artery and facial vein is there, and you have the submandibular lymph nodes and you have the submandibular gland. These are the contents, right? So even if you mention this much, that's pretty much enough. So superficial part of submandibular salivary gland and the facial vein and submandibular lymph nodes, they are superficial, whereas artery is deep. So artery is deep, and the vein and the lymph nodes, they are superficial. So that's another thing. Then you have submental artery. You have, even though this is not a submental triangle, but it has submental artery, it has mylohyoid nerve and vessels. So mylohyoid nerve is there, and there's mylohyoid vessels, right? That's one thing you need to mention. See, nerve to mylohyoid, that's here. And then you have the submental artery. So submental artery, facial artery, then you have nerve to mylohyoid, and then you have mylohyoid vessels. And then you have hypoglossal nerve as well. Hypoglossal nerve is the cranial nerve, right? So hypoglossal nerve is also there. So that's about the contents of the interior part of the digastric triangle. When you talk about posterior part, which is posterior to the mylohyoid, so the superficial structures are going to be the lower part of the parotid gland. We cannot see it right here because these are kind of uh, deeper structures. So lower part of the parotid gland is the external carotid artery before it enters the parotid gland. And we know parotid gland, its blood supply is external carotid artery, right? So both of them are there. Then the deep structures passing between external and internal carotid arteries are the all the muscles, styloglossus, stylopharyngeals. Then you have the glossopharyngeal nerve, glossopharyngeal, and above you had the hypoglossal nerve, right? So glossopharyngeal here. Yeah. Then you have your pharyngeal branch of the vagus nerve. So vagus nerve is also here. You have the styloid process. So these are the deeper structures. You have styloid process, and you have a part of the parotid gland as well here, and you have parotid gland in the superficial structure as well. Deeper structures are, these are exactly the same structure that the carotid sheath, if you remember and if you can recall, internal carotid artery, internal jugular vein, and vagus nerve. These are the contents of the carotid sheath as well. So these are the contents. I know this might get a little complicated, but you just need to know that these are a bunch of muscles which are very easy, and then you have two nerves, glossopharyngeal and vagus, right? And then here you have the parotid and its blood supply superficial, and here you have the basic um, muscles, and you have these two nerves, and then you have the styloid process, and also a chunk of parotid gland. This is the carotid sheath. That's how you can relate and learn. And here you know that you have the facial vein and facial artery that I've already shown you from diagram, so you should stick to your memory. And you also have submandibular lymph nodes, and you also have the submandibular salivary gland. So even if you mention this much, that's enough. But for extra information, you need to know hypoglossal nerve. So next we have the glossopharyngeal nerve, right, in the posterior aspect here, and also vagus. Here you have the hypoglossal. You have mylohyoid nerve and the vessels. Mylohyoid because that's the floor, right? So yeah, and everything, all of these structures are lying on the mylohyoid because they're superficial to mylohyoid. Now, moving forward, we're going to talk about the carotid triangle. Now, carotid triangle, okay, so here you can see these are the two diagrams. Let's just look at them first and then we'll move forward. And yeah, so this diagram is suprahyoid region, contents of submental and digastric triangle are also shown. So submental is this, digastric is this, right? So digastric, we've already covered that you have the what do you have? Let's see, what do they have here? Superficial part of the submandibular gland and the lymph nodes. Then you have the this is not there. You have the submental artery, you have the facial artery, and you also have the nerve to mylohyoid. Remember, because that's the floor that they were lying on. Hypoglossus is the floor, so that's not counted. Okay, then you have submental triangle with That's a submental triangle. And then you have mylohyoid as a floor, this is anterior belly, and you also, okay. Now let's come to the submental lymph nodes. So submental triangle. Submental triangle has submental lymph nodes, and it has, what does it have? It has this very important vein, right? If you can recall, submental veins, they come together and they form this vein, which is known as anterior jugular vein. So submental veins come together to form anterior jugular vein. So this is your submental triangle, right? Now coming here, this is a coronal section through the roof of the mouth. So if you look from the roof of the mouth, this is what it looks like. But anyways, that's not important for you for now. Moving forward. Okay, this diagram, this is again submental, right? So now we know these are the digastric muscles, the anterior belly on the either sides. Then you have submental lymph nodes. You have submental veins coming together to form anterior jugular vein, right? And the floor is mylohyoid muscle. Here you can see this is your submandibular. So we have what? We have mylohyoid nerve and vessels that we know. Then you have the submental artery also in the interior portion. Then you have the hypoglossal nerve. You have submandibular lymph nodes. You have facial vein. You have facial artery. So these are the contents. What is this? This is just about the floor. So you have mylohyoid as a floor, hypoglossal, and middle constrictor. I was telling you, right? It's not visible, but you can see here. That's the floor, middle constrictor. And yeah, so these are the diagrams. It's important to see the diagrams as well. Here you can see this is the digastric triangle, this is the submental triangle, this is the carotid triangle, and here you'll see this is the submental triangle. Oops, sorry. This is the submental triangle right here, and this is the muscular triangle, right?